Hi, I'm Kirsty Buising. I'm one of the infectious diseases physicians working in VIDS here at the Royal Melbourne Hospital. These are my myth-busting questions. Will drinking black tea first thing in the morning reduce my risk of getting COVID-19? No, haven't heard that that's anything that's going to reduce your risk of getting COVID-19. No, sorry. Should I be stockpiling up on vitamins like vitamin C to prevent COVID-19? At the moment, we'd say there's no evidence that there's any benefit from doing that. Vitamin C is something that people are studying, its impact on outcomes from infections, but at this point I'd have to say there's no evidence for us to suggest you should be doing that. Does taking ibuprofen worsen COVID-19 symptoms? So that's a really good question. My understanding is that in the early days of COVID-19, an alert did go out. There were some young people who had bad outcomes, I believe it was in France, and there was a common thread that they were taking a group of medications called non-steroidal anti-inflammatories. So an alert went out to be cautious about those drugs. So I think in a lot of guidelines at the moment it says to avoid using them if you have a patient who already has COVID-19 infection. So if you don't have COVID-19 infection, I don't think there's any evidence that you need to change your medication otherwise. Do hand dryers kill coronavirus? No evidence at the moment that that's a useful way to prevent infection. I guess you're getting at temperature changes and do temperature changes impact on the virus? The answer to that is maybe, but we really don't know, and I wouldn't trust a hand dryer as the way to prevent coronavirus. Does gargling with warm salted water help? No, not in terms of preventing infection. It might help relieve the symptoms. If you had COVID-19 and your main symptom was a sore throat, then sometimes as symptomatic management people might choose to do that. You would only do it if it was making you feel better, but otherwise it wouldn't be something we'd be recommending.